Hello, my name is Dr. Dewan S. Raja. Today I will discuss about mitral stenosis. Mitral stenosis is a narrowing of the mitral valve. Mitral valve is a bicuspid valve. It is also called left atrioventricular valve, which regulates blood flow from the left atrium to the left ventricle of the heart. The condition obstructs the blood flow, leading to increased pressure in the left atrium, pulmonary congestion, left atrial hypertrophy, reduced cardiac output. It also develops pulmonary hypertension and eventually right ventricular hypertrophy. So this is the left atrium, this is the left ventricle, this is the mitral valve. Okay, or left atrioventricular valve. This is a bicuspid valve, just two cusps, and this is normal heart. So from the lungs, the oxygenated blood come to the left atrium, then it goes through the mitral valve to the left ventricle. But in case of mitral valve stenosis, this passage is narrowed like this. This is an image from Mayo Foundation. So it shows that this is the narrowing or stenosed mitral valve. So flow of blood from the left atrium to the left ventricle is obstructed. It shows here narrowed mitral valve. Typical mitral valve is it looks like that. Here is a typical mitral valve. This is the narrowed mitral valve, and our case is mitral stenosis. There is narrowing of the left atrioventricular opening or mitral valve opening. Okay, so here we go to here, and what are the causes of mitral stenosis? Number one, rheumatic heart disease, most common cause, usually follows untreated or inadequately treated streptococcal throat infection. Rheumatic fever will develop that will lead to damage to the valve, like particularly the mitral valve. So the rheumatic fever happens following a streptococcal throat infection. Causes scarring and thickening of the mitral valve. Congenital mitral valve stenosis, a rare birth defect where the mitral valve is abnormally small or malformed. Calcification of mitral valve, common in elderly population. Individual, leading to stiffness and narrowing of the mitral valve in an elderly people. Autoimmune disease, that is lupus, systemic lupus erythematosus, can lead to inflammation and damage to the mitral valve. Infective endocarditis, infection can cause damage and scarring of the mitral valve. Okay. So, what are the symptoms of mitral stenosis? Symptoms often develop gradually and worsen over time, that include dyspnea, shortness of breath, especially during exertion or at night, fatigue and weakness due to reduced cardiac output. Cardiac output is reduced because the left ventricle get less amount of blood because of mitral stenosis. Left atrial blood is obstructed to reach the left ventricle. According to the Frank-Starling law, if there is less blood in the ventricle for systole, then the pressure will be decreased. So that is the reason for for reduced cardiac output. So less amount of venous return will lead to less cardiac output, less return of the blood from the left atrium to the left ventricle will lead to decreased cardiac output. Palpitation often due to atrial fibrillation. Atrial fibrillation, particularly on the left atrium, because left atrium is hypertrophied and abnormal wall is abnormal, that will lead to left atrial fibrillation. Okay, we got that. Left atrial fibrillation. Hemoptysis, coughing of blood from pulmonary congestion. As because blood cannot go to the left ventricle, there will be stagnation of blood in the pulmonary circulation. There will be pulmonary congestion and breakdown of the capillary wall that may lead to hemoptysis. Chest pain, angina, uncommon but can occur because of low cardiac output. There may be lack of blood flow through the coronary arteries. So there may be chest pain, although not very common. Edema, swelling leg and feet due to right heart failure eventually. Right heart failure due to pulmonary hypertension. Okay, there will be right heart failure. Hoarseness, also called Ortner syndrome, due to compression of the left recurrent laryngeal nerve by an enlarged left atrium. Dysphagia means difficulty in deglutition or swallowing due to compression of the esophagus by enlarged left atrium. So esophagus becomes sandwiched between the pericardium and the thoracic vertebra due to the enlarged left atrium that will press on the pericardium uh, along the oblique pericardial sinus. Then it will squeeze the esophagus against the thoracic vertebra. That will lead to dysphagia. Malar facies, particularly over the zygomatic bone, red coloration due to vascular dilation because of lack of oxygen and pulmonary hypertension. Low cardiac output will lead to hypoxemia and vasodilation that will lead to malar facies, red color over the face, particularly over the zygomatic bone. Diagnosis of mitral stenosis, physical examination, diastolic murmur. The characteristic is low pitched, rumbling mid diastolic murmur with pre-systolic accentuation. Murmur best heard at the of the apex of the heart. Where is the apex of the heart? The left fifth intercostal space, just medial to the midclavicular line. With the patient in the left lateral decubitus position, we can auscultate the best mitral stenosis murmur. Loud S1 or fast heart sound and opening snap after S2. Opening snap due to there is some or significant stenosis, so there should be an opening snap after the second heart sound. Echocardiography, that is gold standard. Transthoracic echocardiography assess the valve structure, severity and pulmonary pressures. Transesophageal echocardiography, more detailed assessment, especially before intervention. So physical diagnosis, physical examination, echocardiography. We have also other like ECG or electrocardiography, shows left atrial enlargement, may reveal atrial fibrillation. We'll get in ECG P pulmonal. P is tall and notched P wave, and we'll get the other features of right ventricular hypertrophy. In chest X-ray, left atrial enlargement, pulmonary congestion. We'll get double shadow sign. The left principal bronchus may be elevated. The left atrial shadow will see very large. Cardiac catheterization complex used in complex cases to measure pressure and assess severity. Okay, if you look at the X-ray in mitral stenosis, okay, if you look at the X-ray, what we'll get? Double shadow sign. This is the margin caused by enlarged left atrium. This is caused by right atrium. This is the left atrial, right atrial. This is a double shadow sign. Enlarged left atrium here. Here also left atrium is enlarged. And elevation of the left principal bronchus from the trachea. This will be elevated. Okay, this has been taken from Google image learningradiology.com. Okay, we got that. Now we'll go to the treatment of mitral stenosis. What should be the treatment? Treatment of mitral stenosis is medical management, diuretics like furosemide, spironolactone, reduce pulmonary congestion, beta blocker like atenolol, okay, and calcium channel blocker or calcium channel blocker cannot that control heart rate, especially in atrial fibrillation. In atrial fibrillation rate is very high, so it should be decreased, and this beta blocker will increase the force of contraction, decreases the heart rate. Okay. Anticoagulation, warfarin, if atrial fibrillation is present to prevent stroke. In atrial fibrillation, there will be too much contraction of the atria, but not forceful contraction, and there will be the chance of formation of blood clot that may go to the brain. Okay, so anticoagulation is essential if atrial fibrillation is present to prevent stroke. Antibiotic prophylaxis for patients with rheumatic heart disease to prevent recurrent infections. What are the surgical and interventional treatment for mitral stenosis? Percutaneous balloon mitral valvoplasty, PBMV. Preferred treatment if the valve is not heavily calcified, then we prefer that. A balloon catheter is used to widen the narrowed valve. Okay. Mitral valve repair, rarely done but may be considered in specific cases. Mitral valve replacement used for severely calcified or damaged valves. Mechanical valve require lifelong anticoagulation. Bioprosthetic valves less durable but do not require lifelong anticoagulation. Okay, so these are the management, surgical management, mitral valve replacement, mitral valve repair, and percutaneous balloon mitral valvuloplasty. Complication and prevention of mitral stenosis complication, atrial fibrillation, increases stroke rate. So blood clot from the left atrium, maybe the left ventricle, then the branches of the arch of the aorta may reach the brain, may lead to stroke. Pulmonary hypertension due to increased left atrial pressure, right heart failure due to chronic pulmonary hypertension, thromboembolism, increased risk of stroke. Prevention of mitral stenosis, early treatment of streptococcal throat with antibiotic to prevent rheumatic fever, regular follow-up for patients with mild stenosis, management of atrial fibrillation to prevent complication. Okay, these are the prevention, this is the complication. And that's all about the mitral stenosis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.